Third subtype of you can say long bone, that is modified long bone. In this modified long bone, here you can see two ends, one shaft, but here there is some modification. Normally long bone has elongated shaft, okay, but here you can see clavicle has with curvature, shaft with curvature. In this modified long bone, maximally there is no medullary cavity. Typical long bone has, you can say, medullary cavity well defined, but modified long bone has no medullary cavity. First bone of the upper limb, that is key bone, that is clavicle. You must know only 2 points for side determination of the clavicle. That is number 1, that is medial 2/3 convexity. Medial 2/3 convexity always anterior, and conoid tubercle always inferior side. Here you can see there are two clavicle present. Number 1, medial 2/3 convexity anterior, conoid tubercle always inferior. This one, right sided clavicle. In second clavicle, here you can see medial 2/3 convexity anteriorly and conoid tubercle always inferiorly. With these 2 points, you can determine the side, that is this one right sided clavicle and this one left sided clavicle. Other points of clavicle for viva purpose you should know, that is medial end of clavicle, that is quadrilateral. Lateral end of clavicle, that is flattened from above to down. For shaft, medial 2/3 part, that is convex anteriorly. Lateral 1/3 part, that is concave anteriorly. And there are 3 structures present at the inferior surface of the clavicle, that is number 1 subclavian groove, number 2 that is nutrient foramen, and number 3 that is conoid tubercle. These 3 structures present at the inferior side of the clavicle. So this clavicle, that is you can say left sided clavicle. After completion of 2 ends of you can say clavicle, next part of the clavicle, that is shaft of the clavicle. Here you can see this shaft, that is not a straight one as like a other long bones, but clavicular shaft, that is a curve shaft, that is S shape. Here you can see this one convexity and this one concavity. Convexity and concavity. Now shaft is divided into 2 parts. Here you can see this one medial end, this one lateral end. This is a right sided clavicle. From medial to lateral side, there is 1/2 portion that is convex forward, that is medial 2/3 part, convex forward, and lateral 1/3 part, that is concave forward. Lateral 1/3 part. Lateral 1/3 part as like a lateral end of the clavicle. It is flattened from above to downward, and because of that it has 2 border and 2 surface. This one anterior concave border and this one posterior convex border. This one superior surface, and here you can see this one inferior surface. Here you can see which are the attachment of lateral 1/3 of the clavicle. Anterior concave border, that gives origin to one of the important muscle of the shoulder region, that is deltoid muscle. Clavicular fiber of deltoid muscle originated from anterior border, lateral 1/3 of clavicle. As like here you can see this one posterior border, the posterior convex border, that gives insertion to one of the important muscle of the back, that is trapezius muscle. Now 2 surfaces of clavicle. Superior surface, that is subcutaneous, that is it is covered with you can say skin and superficial fascia, but inferior surface has one tubercle, that is known as conoid tubercle. It is one elevation present at the inferior side, conoid tubercle, and another one continuous with the conoid tubercle, there is one linear elevation present, that is known as trapezoid ridge. This conoid tubercle and trapezoid ridge that gives attachment to one important ligament, that is coracoclavicular ligament. Medial two-third part. Medial two-third part of clavicle, that is, you can see quadrilateral or rounded on each side, and because of that it has four surface: superior surface, inferior surface, anterior surface and posterior surface. Superior surface on the medial side of the clavicle, it gives origin to one of the important muscle of side of neck, that is clavicular head of sternocleidomastoid. In inferior surface, there are two features are present, that is one groove that is known as subclavian groove. This subclavian groove that gives insertion to one of the small muscle which is originated from first rib, that is a subclavius muscle. Insertion of subclavius muscle occurs here, that is subclavian groove. It also gives attachment to one membrane that is known as clavipectoral fascia. Posterior surface of the clavicle, that is situated near the, you can say, sternum, gives attachment, not origin, but it gives attachment to some fiber of sternohyoid muscle. There is one oval impression, or you can say rough area, over the medial one-third of the shaft of, you can say, clavicle, inferior surface, that gives attachment to one ligament with the first rib, that is a costoclavicular ligament. Which are the attachment over the medial two-third of the shaft? Anterior surface two-third portion, that convexity, that gives origin to one of the important muscle of the pectoral region, that is clavicular fiber of pectoralis major muscle. Now, how to remember? So here you can see medial two-third part has a four surface, with each and every surface has its own muscle. Anterior pectoralis major, superior sternocleidomastoid, posterior sternohyoid and inferior subclavius. This one, that is a nutrient foramen besides the subclavian groove at the inferior surface, middle one-third of the clavicle, that gives passage to suprascapular artery.